Joining us on the phone to discuss this is one of the members of the task force, Dr. Wanda Nicholson. Dr. Nicholson, welcome to the show.
Thank you. Thank you for having me.
And one thing I want to do really quickly is just read the guidelines set forth by the U.S. Preventative Services Task Force. So healthy women, age 21 to 65, recommendation to get a pap smear every 3 years. Women age 30 to 65 get a combination of a pap smear and HPV test. If they test negative for both, they can then reduce frequency to once every 5 years. And then the panel advised against women 65 and older who have had adequate prior screening from getting further screenings. And then women under 30 should not get HPV testing, either alone or in conjunction with the PAP. So walk us through this, Dr. Nicholson, and how you came to this conclusion.
Well, these updated recommendations are based on a series of large randomized clinical trials as well as large cohort studies in which large groups of women were followed over 5 years to look at the reduction of cervical cancer deaths using different screening strategies.
Right, because as you know, it's very controversial to a lot of doctors because they know that if you extend that time, first of all, a lot of women don't come in for their regular pap smear anyway, and it's hard to find them, track them down. And then if you extend that, they're really going to not take it as important or if they should come in. And we do know that cancer does grow slowly, as in cervical cancer, but we also know that if you get to it early, you can use small procedures instead of waiting until something gets so progressed that you need a hysterectomy or radiation.
Well, first of all, I agree with all of your concerns. And let me say that the task force fully supports cervical cancer screening. The goal of the cervical cancer screening guidelines is to provide guidance on the best way to screen. The guidelines are not intended to replace the individual conversations, individual decisions of an individual woman and her doctor.
Yeah, but if the individual woman and her doctor make that decision they need it more, then you actually will spend an hour on the phone with an insurance company trying to argue for this woman, and I do that at least once a week because when they started to try and stop STD testing, when they started to try and reduce contraceptive coverage, I mean, we're really seeing lately a whole issue of government lowering the rights of women as far as health care. And it's coming at first they tried to do the mammogram, then contraception, now the pap smear. It's a whole host of things.
The coverage of the pap smear is mandated by the Department of Health and Human Services. It's mandated to be covered. HPV testing is mandated to be covered based on a recommendation of the Institute of Medicine that was made, I think, 3 to 4 years ago. So these recommendations will not prevent individual physicians and their patients, depending on that individual clinical presentation, for being able to do a PAP or HPV more often. And these are complex recommendations, and women should continue to have conversations with their clinicians. These recommendations should not replace those individual conversations.
And Dr. Nicholson, thank you so much for joining us.
Thank you.
And if there's any takeaway for viewers, it's that you need to have that discussion with your own individual doctor. Do not stop making those appointments. Don't stop going to see your doctor because healthcare goes beyond one screen, one conversation. It's a lifelong relationship with your physician.